Good evening, everyone. Welcome to Monday night's Facebook Live. It's great to see you all again. And if you're watching this on the replay, thank you for stopping by. So we do Facebook Lives every Monday night. And these are a great opportunity to get information. I cover a whole variety of topics. And these are to empower you, to give you more information so that you can make more informed health choices, to share with you things that I'm passionate about. And of course, we do great things here at Hyperbarics RX all the time. I'm sitting behind configuration 8. This is one of our newest chambers here at the facility. And though our company has been in business for coming up on 20 years, we've been doing hyperbaric oxygen therapy. We continue to upgrade our equipment. We have new equipment that comes in, and this is just one of the many reasons why you want to do hyperbaric oxygen therapy with us here at the facility. So again, welcome, welcome. And of course, our Facebook Lives, this is an opportunity for you to ask us questions real time in the chat. If you're watching this on the replay, feel free to send us a direct message or give us a call and schedule a consultation. So again, lots of great information here that we talk about. So again, thank you so much for coming by. And tonight's topic again is we're going to specifically talk about what is a personalized dive plan. You know, one of the things with hyperbaric oxygen therapy is many people don't know a lot about it. So very often there is total trust, total confidence being placed in the hyperbaric oxygen provider. And the good news is it's really hard to hurt someone with a hyperbaric chamber. And because of that, what regulation we do have, what oversight we do have, is almost completely unenforced. And while people aren't necessarily getting hurt, again, really hard to hurt somebody with a hyperbaric chamber, and I'm not sure for trained certified operators. I mean, again, we're an ANDI Certified Hyperbaric Facility. ANDI as an organization has a 32-year perfect safety record in over 60 countries. So far, so good. And at least at an ANDI facility, there's a whole bunch of things that just don't happen. There's never been certain considerations that happen at other sites all the time. We've never had those problems. So little interesting there. And this personalized dive plan is really important. Last week, I talked about how hyperbaric oxygen therapy and quantum nutrition helps post-COVID syndrome. We use state-of-the-art testing methods here. We have DNA testing, we have quantum nutrition testing. Hyperbaric oxygen is the primary component, but it's not the only component. Sometimes there are other pieces that are required in order to get the mitochondria functioning very well. So go ahead and check that out on the replay. And let me take an opportunity and just introduce myself. Again, my name is Laura Betts. I am president and founder of Hyperbarics RX in Fort Lauderdale. And I'm going to do a Facebook video in a few weeks talking about my personal story and why I founded this clinic. And if someone would have told me years ago when I was a mixed gas diving instructor and teaching people how to essentially exceed recreational diving limits, I would not have thought that I would have been here. So very interesting thing. We don't choose the things we believe in, they choose us. And it was because of my own personal health narrative. I am alive because of hyperbaric oxygen therapy. In fact, my health, wellness, and overall, just I feel really good. And that's directly because of hyperbaric. So very, very proud and passionate of it. We are located at 3701 West Commercial Boulevard in Fort Lauderdale. However, we do telehealth consulting in hyperbaric and quantum nutrition testing all over the country. So if you need some help, if you need support, please feel free, reach out to us. We'd love to help you if you'll let us get a consultation scheduled with us, and we'll see what we can do. I am also a member. I sit on a few different medical boards. So I'm a member of the longtime member of the ANDI Diving Medical Board, and I'm also on the ANDI Hyperbaric Medical Board. I'm vice president of substance abuse program programming and protocol integration for International Hyperbaric Medical Foundation. And hyperbaric plays a significant role in the treatment and management of addiction. It helps to heal traumatic brain injuries and many consequences. Many people that are struggling through addiction, there are underlying brain injuries, there are underlying root causes. And if they didn't have traumatic brain injuries before addiction, then it's very likely as a consequence of some of the injury and damage that they have them now. And the hyperbaric can be integral to their successful recovery. We are an ANDI training and research site, and that's really a big deal. And I'll talk a little bit more about that as I share what's involved in a personalized dive plan. So let me go back and start again, getting back to our topic. So what is a personalized dive plan? So many people do not realize that oxygen mechanisms, the different things that happen in the body, are highly dosage dependent. As a researcher and someone who is just very passionate about hyperbaric medicine in general, I am absolutely fascinated at how specific some of these switches are. And there are very, very different protocols depending on what somebody is trying to do, depending on what your personal goals are. Not to mention, and at the risk of overstating the obvious, everybody is also not exactly the same. So different people may be at a different point in their healing journey. They may have different wellness goals. I'll talk a little bit about some different ways that our clients are applying hyperbaric oxygen therapy. And again, interestingly enough, so people may not realize that a lot of sites, everybody is treated at the same dosage for the same amount of time. That was one of the reasons why the monoplace, one person hyperbaric chamber came into practice. Multiple person chambers were being utilized quite a bit more. And I'm going back to the 70s now. So this is a little step back in the hyperbaric medical industry. And it was very, very common for hyperbaric chambers to have more than one person in the chamber. And that's okay if everyone is treating at the same dosage for the same amount of time. But what the research continues to demonstrate, again, is that these different things in the body are highly dosage dependent. And depending on what our goals are, requires a very different dosage. That's the amount of oxygen that's being dissolved into tissue, duration. Some of these switches are only on during the target pressure. So do we spend 30 minutes at the target pressure? Do we spend 60 minutes at the target pressure? Do we need to be 90 minutes at the target pressure? And again, depending on the goal, depending on the outcome. On the telehealth side of things, I'm doing an awful lot of consults right now. People are reaching out for nutritional components. They're reaching out for consulting support. They're not really seeing the benefits that they were expecting. And in some cases, they're doing hyperbaric oxygen therapy, and they were under the impression that they were going to feel amazing, and they're not feeling better. So they're trying to figure out what's going on there. And a lot of those times we come back to find that the dosage is not appropriate for their needs. The dosage is too aggressive. The dosage is not aggressive enough. In some cases, they're not even using any oxygen. One of my earlier videos, I did a discussion on how long is a 60-minute hyperbaric session. And I elaborate on duration, on treatment time pretty extensively. Now, too high, too low, too short, improper frequency, these things aren't harmful. Again, one of the most wonderful things about hyperbaric oxygen therapy is that when it's administered properly, an ANDI Certified Hyperbaric Facility by ANDI Certified Chamber Operators, there's no negative here. There's no downside. Our body handles oxygen very well. Even a little oxygen is good. Our body has an incredible ability to heal and regenerate, and hyperbaric is able to support the body in doing that. It can turn regenerative switches the body was not able to heal, and now the body can heal because it has the oxygen, the primary component. The term for that is angiogenesis. So this is some pretty neat stuff. And again, too high, too low, improper frequency, too short of a session, wrong dosage, we're not causing any harm here, but are we creating the best opportunity for efficacy? And that's something that's very sensitive to me as somebody that's had a personal narrative. Well, how long do we want to be in pain? The answer is yesterday. I want to be out of pain yesterday. I want to achieve being out of pain as quickly as possible in as few sessions as possible. So dosage really matters here. Again, are we creating the best opportunity for efficacy? What are the goals? Why are we using hyperbaric oxygen? It's able to do so many different things. It plays a role in anti-aging. It plays a role in biohacking. It plays a role in reproductive and sexual health. It plays a role in cardiac wellness. It's well known for healing wounds that don't heal, the unhealable. Are we trying to kill a pathogen? Are we trying to suppress a negative immune response? Is this fibromyalgia? Fibromyalgia? What are we doing? What is the goal here? And this is where a lot of it is missed. This is where, again, while the hyperbaric is good and the hyperbaric is doing something beneficial, is it doing it in a way that's creating an opportunity for efficacy to see the results we're looking for in the window of time? So here's a really great example. Many of you right now are just about to give up on some New Year's resolutions, and I hope that's not the case. I hope you keep going. A lot of people, beginning of the year, they make a New Year's resolution that they're going to get in better shape. They make a New Year's resolution that they're going to get dietary changes. Right now, we have a lot of people on our schedule that haven't been to the gym in a few months, a few years. Maybe they're just beginning their weight training regimen for the first time. And when we weight train, when we exert our muscles, that soreness that comes, there's a name for it. It's called delayed onset muscle soreness. The term abbreviation is DOMS. And hyperbaric oxygen therapy, when applied in the right window of time, at the right dosage in a personalized dive plan, is not only going to help that person heal faster, but it's going to help reduce the symptoms from the delayed onset muscle soreness. They're not going to be in as much pain, and their body is rebuilding that muscle about 80% faster than it would without the hyperbaric oxygen therapy. That's some pretty incredible stuff. So in a personalized dive plan, when are your workouts? We want to schedule your hyperbaric session in a very specific period of time so that we can make sure that we are turning off the negative switches that are ultimately going to result in all that pain and soreness, and helping to support the body so it can reduce inflammation and heal, build muscle, regenerate faster. Hyperbaric, among other things, at proper dosages, it has an analgesic benefit. And that benefit is not just from the reduction of inflammation. It downregulates the neurotransmitter, the pain receptor, clinically documented to be affected for about 14 days after a single hyperbaric session. So yeah, hyperbaric plays a role in pain management. Is your personalized dive plan simply to create an opportunity that you don't need to take pain management drugs? or take less pain management drugs as we move through that. Many people have already had the experience with the initial steroids, the initial intervention, the initial pharmaceutical. It was working, and now it's not working anymore. And now we have all of these side effects, and the doctor is taking us off the drug. And now what are we going to do? So again, personalized dive plan. And this is what we do here. And this is one of the things that's very, very different. Another example of a really important aspect of a personalized dive plan is what's going on with that person's mitochondria. What's happening? Uh, Mitochondria is essentially what makes everything in the body happen. If we are sick, if we are injured, if we are not in an optimal state of health, ultimately that's because there's some kind of mitochondria damage. Now, I did a video a few Facebook Lives ago where I talk about mitochondria and the root cause of disease. So I encourage you to go check that out, and I elaborate on that a little bit more. And bringing back to talking about our personalized dive plan, if somebody's mitochondria is damaged, if their particular condition, their illness, their issue involves severe mitochondria damage, we see this with chronic conditions. They've been in an inflammatory cycle. They've been dealing with chronic inflammation for a really long time, and their mitochondria, as a consequence of a variety of factors, the biggest one being that it's been deprived of oxygen. The mitochondria needs oxygen to make energy. That's what drives the engine in the mitochondria. So if we've been in an inflammatory cycle and the mitochondria is actually damaged, it's not working properly, then putting ourselves into a situation where we're trying to supercharge mitochondrial required mechanisms, all we're going to do is make the person feel very tired. And while we are doing good things, that dive plan isn't working for that individual. And often they quit the therapy because they don't feel so good. I do consults on this from people, not here at our facility, but I do consults from people all around the world that tell me a story about how they really wanted to do hyperbaric oxygen. They thought it was amazing. They've heard all about it. It's the greatest thing. And they're really disappointed because they did a few hyperbaric sessions and they are, quote, miserable. And there's information missing there. Their personalized dive plan is incomplete. We may need to focus on supporting the mitochondria and creating an opportunity to get some mitochondrial repair. And that dosage may be different than what you would normally see for that particular indication. Again, we may need a personalized dive plan to customize it to the individual, to create the opportunity, to create a better opportunity for efficacy, to improve their outcome. Another real good example of that, I see this all the time, Lyme disease. So Lyme disease is challenging, and very often there's a long period of time before the person actually finds out that they had Lyme disease. In my professional experience, Lyme disease is commonly misdiagnosed. Hyperbaric oxygen therapy has the ability to give us a piece of information that would demonstrate that there is a pathogen. And we have people that come to us with one diagnosis, and it turns out they actually have something else. And that's a great piece of information because I like the idea of an untreated infection that we can address as opposed to a mysterious collection of symptoms that no one knows why it's happening. Now, very often with chronic Lyme, because there's been such a delay, the person may have even been treated incorrectly, right? They have an infection, but they've been treated for a neurological injury. with symptom management that has challenging side effects and causes additional immune issues. So, doing an initial, the typical Lyme protocol, they're not ready for the typical Lyme protocol. They're not able to dive once a day, 5 days a week for 8 weeks. Not only that, at the end of that once a day, 5 days a week for 8 weeks, if they did that, assuming that they completed the block of 40, which is what Fife's research was very specific about, assuming that they did that, because we didn't address things beforehand, it might not have been impactful. Yeah, they might have got some benefit, but if the goal was to eradicate the Lyme disease, because their personal dive plan didn't take some other things into account, it was trying to do something else, well, they're going to need to do a lot more hyperbaric sessions. And we're real sensitive to that. Many of our clients are coming to us and they're using discretionary healthcare dollars in order to do hyperbaric oxygen therapy. Hyperbaric is not covered by insurance for most things. And many times when the person is using it for a chronic condition, their ability to earn a living has been affected, or we're on a clock and we're trying to get these symptoms, we're trying to get these root causes addressed before it impacts their ability. So again, this is where a personalized dive plan is really important, because not only are we going to create a better opportunity for efficacy, but we're going to utilize those dives in a much more efficient, a much more effective way. Yeah, I realize as a hyperbaric facility, we shouldn't care and we should just want you to keep doing lots and lots and lots of dives. But that's not what it's about. That's not what we're looking for. Again, there are so many different ways to use hyperbaric oxygen therapy, and I would much rather be working with somebody to detox and balance their body to get ready to have a baby and bring a wonderful, healthy new life into this world and have an amazing, simple, well, there's no such thing as a simple pregnancy, but to have an uneventful pregnancy, maybe even enjoy and not deal with all these things that we keep hearing about. Maybe we want to do biohacking and anti-aging so that as we get older, we're able to enjoy all the things that we worked for and not spend it in a home with a neurodegenerative condition. Maybe we want to be out there thinking and enjoying quality of life. So there's so many other things that we can do and other ways. We want to get you better. That's okay. And we have so much work to do. We have so many people to help. So little different perspective there. So again, in your personalized dive plan, what are your goals? Less pain, less fatigue, reduce brain fog. Do we need to do an intensive block? Are we ready to do an intensive block? Are we using it to improve an elective surgical procedure? Or a stem cell placement procedure, and we're going to use the hyperbaric for pre-surgical conditioning to reduce complications and improve our outcome. And we're going to use post-surgical hyperbaric oxygen therapy to heal faster, recover faster, reduce inflammation, be out of pain. I'll give you another example of a personalized dive plan. Again, hyperbaric is a best kept secret. One of these goals of Facebook Live is to educate you about your body and all of the different ways that it can heal and balance naturally. And it's an incredible regenerative machine. We are always making new cells. And we can take advantage of the fact that hyperbaric makes that process, angiogenesis, happen better and more efficiently. Again, in general, fibroblast tissue, about 80% faster undergoing hyperbaric oxygen therapy. So on the other side of after we address the root cause of a chronic health condition, after we have quality of life, there's so many other incredible things. But you know what happens sometimes? A lot of times the holidays, a lot of people, they go off their diets. Maybe the immune disorder reversal diet that they've been doing as part of a nutritional optimization program paired with a hyperbaric wellness program. Maybe they didn't do that over the holidays. Maybe we had some alcohol. Maybe we had some stress. We certainly didn't get enough sleep, and up we're in an immune flare. Okay. So in this particular situation, and I have a client that's moving through this right now, we did a personalized dive plan, a 21-day protocol, and the protocol is different than the normal anti-aging and wellness that they do. And we're doing a 21-day protocol to reduce the symptoms of the immune flare. We've done a couple dives already. We brought down redness. There's no more heat in the area. Noticeable reduction of pain in the joints. Fatigue is better. So this personalized dive plan is a 21-day program. We have pro athletes on the schedule all the time that are prepping for a race or prepping for a fight. So depending on where their fight is, how they're training, what their individual goals, again, personalized dive plan. So this is one of the many, many reasons why you want to work with our facility. We have, in addition to having certified chamber operators that are able to duplicate the dosage of the required protocol, as an anti-hyperbaric facility, we have more information. In addition to the standard protocols, we have all of the international indications and all of the published research protocols. So we're going to customize that and implement that. No, we don't treat everybody the same because everybody isn't the same. We don't dive everybody for the same amount of time because different profiles, depending on the goals, require different things. We had someone come in here last week, and they are using hyperbaric as a dental adjuvant. They've just had some very serious oral surgery, and they're using hyperbaric oxygen therapy to help the body heal faster, to help regenerate that bone faster, and most importantly, to prevent the infection so that they don't lose their jawbone. Not only do we have the ANDI protocols and certified chamber operators, but we are experienced. Hyperbaric is a growing modality, and it's wonderful that there are many people that are getting into hyperbaric medicine. But where is your dive plan coming from? What information did the doctor base the protocol? Again, there are many physician sites. Every single person is under insurance, under direct medical oversight, and they treat everybody at the exact same dosage, no matter what indication they are there for. Is the person that you're working with trained or certified at all with that? Pretty cool. Thank you, Tracy, by the way, for joining us again. It's great to see. And thank you for sharing that. And there you go. She's sharing on her personalized dive plan. Last 2 sessions wasn't as many sessions as someone else might need. And then all of a sudden, and that's our experience. We have a lot of experience. Time takes time. Some of these body's healing mechanisms, there's a little delayed reaction there. If the dive plan is too short, if we cut off the healing mechanisms, we're not going to get that big wow with that. And thank you for letting me know about the audio. We are learning and growing. And as I continue to do this, we're bringing more and more technology into the place with it. So again, our experience here, we're not learning on you. We have over 20 years of hyperbaric oxygen therapy, and that's what the research sites are for. That's what the medical board is for. When you're coming to our facility and you're saying, hey, where did this protocol come from? The ANDI protocol list is based on facilities all around the world that have fed back data real time. And those protocols were based on published research, in some cases, international indications. Is the hyperbaric a primary therapy? Is a hyperbaric an adjuvant therapy? We understand these mechanisms and we can make sure that we're applying the right ANDI protocol depending on what your specific needs are. In addition, we're trained for multi-level profiles, and we're also trained for air brakes. So I'm just going to show you a little bit about our rates. Again, for those of you that are thinking about coming to our facility and those watching this on the replay, these are our current 2024 rates. And you'll notice that we have two different types of services. We have standard hyperbaric sessions, and then what we have are called multi-level hyperbaric sessions. And again, it may be more appropriate. Multi-level sessions are best used where we have different dosages that we're trying to do. And I'll pause. Tracy asked a great question. Is there a protocol for autism? Yes, there is a protocol specifically for autism. The ANDI protocol for autism treats it like a traumatic brain injury. In fact, many children with autism have cerebral edema. The formal protocol is based on a brain injury protocol, and it is once a day, 5 days a week for 8 weeks. But again, that is an absolute perfect example of where a personalized dive plan may be beneficial. In my professional experience, I have literally worked with hundreds of families that have children with autism of all of the different indications. I probably still at this point have done that one the most. When I first transitioned from diving medicine to hyperbaric medicine, almost every client I was working with had a child with autism, and we see them here at the clinic very commonly. So autism is very complex. If you've met one child with autism, you've met one child with autism, and they can have mitochondria damage. They can have very serious issues going on with their drainage pathways, like they're not going to the bathroom. And if they're, for example, not going to the bathroom, then doing an aggressive profile before you're addressing their drainage just doesn't necessarily do what we need to do. I will say that I have been in hyperbaric medicine now coming up on 2 decades, and I have children, little ones, that I worked with that I saw as essentially toddlers, and they are young adults and adults now. And unless you were a very educated medical professional, you could not tell that they had any autism diagnosis. They essentially have made full recoveries and have full quality of life. So it is very effective. Autism dosage is 1.55 dosage. But again, in a personalized dive plan, may be a little bit more appropriate there. Autistic children can be very complex, and sometimes a multi-level profile is very good for them as well, where we're doing 2 different target pressures. The dive is a little bit longer, but then they do that at a reduced frequency. In addition to our dive package programs, we do also have a wellness program. And again, everybody keeps needing oxygen. For as long as we are alive, the primary component for every single thing that the cells in our body do is oxygen. Who wouldn't want to have a little bit more collagen production in their skin? As we age, our skin becomes collagen deficient. That is one of the reasons for ongoing benefits of hyperbaric oxygen therapy. I do a hyperbaric wellness session once a week, and when I'm trying to fix something, change something, when I'm being a little bit more aggressive, I'll do twice a week or a formal block where I'm diving daily. Thank you so much, Tracy. Your comments are amazing. Thank you for coming out and watching this. Again, we love our clients here at the facility, and our goal here is to empower you with information so that you can maintain your health and quality of life naturally. We truly are a Holistic Hyperbaric Center. We are one of the only holistic hyperbaric centers in the state of Florida. So we're coming at the approach of not just managing a symptom. Our goal is to find the root cause. And hyperbaric oxygen is amazing. The oxygen goes everywhere except dense bone. So one of the reasons why it works so well is because it does help to address root causes, even while we may still be determining and getting more information about what those root causes are. So we're like waiting on the DNA test to come back or something along those lines. So we have a tremendous amount of information to share. And we take all of this information and put that together. Again, DNA testing, we have a lot of people, their DNA tests are coming back, and we're finding out that some people detox a lot differently than another group of people. So in their personalized dive plan, we have to take into considerations their detoxification and drainage much more so than we do with somebody that handles that a little bit better. Interestingly enough, some of the things that are coming back on their oxygen requirements on the DNA testing. So really, really quite interesting. So I hope that this was informative. Again, if you are watching this on the replay and you have questions, please feel free to message us and give us a call at the facility if you'd like a private consultation. Again, we'd love to help heal and balance your health naturally. If you're looking to crush your 2024 wellness goals, again, hyperbaric can supercharge your health and wellness goals. You can be your own hero, and we can really do some amazing things. Again, thank you so much for joining me this evening. I do Facebook Lives every Monday at 6 p.m. And I look forward to seeing you on the next Facebook Live. Please like and share. And again, thank you so much, Tracy, for joining me this evening. Have a wonderful night. Happy healing, happy hyperbarics, and I will see you all next Monday. Thank you.